Hi, I'm Dr. Claudia Kim, cosmetic surgeon here at New Look New Life. Today, we're going to explore two of the most commonly discussed non-surgical skin tightening technologies in aesthetic medicine, Ultherapy and BBL SkinTyte. While both aim to restore firmness and youthful contour, they achieve this through very different technologies. And understanding these differences is key to actually selecting the right treatment plan for the right patient. So let's talk about Ultherapy first. What is Ultherapy? It's actually an FDA-cleared, non-invasive laser that uses focused micro ultrasound energy. And its main goal is to lift and tighten the skin, particularly on the face, the neck, the brow, and the décolletage area. And how does it actually work? Well, the science is that the ultrasound energy actually penetrates underneath, deep beneath the skin surface, and it actually targets the SMAS layer, which is the same foundational tissue layer that surgeons lift during a facelift. And by delivering this precise energy at this lower depth, we stimulate collagen and elastin production, which gradually remodels the skin over a period of 4 to 6 months. Now, for the Ultherapy, it usually requires 1 to 2 sessions, and each session will last, roughly about an hour, depending on the treatment area. So the more areas that you're going to treat, the longer it may take. During the Ultherapy, patients will experience a mild discomfort during the procedure and temporary redness or tenderness afterwards. But most importantly, downtime is very minimal to none. And in regards to how long does it last, visible lifting and firming typically appear over several months, and results can actually last up to 2 years in individuals with mild laxity. However, some individuals with moderate laxity may actually benefit from getting Ultherapy every year. Ultherapy is actually really good for patients with mild to moderate skin laxity who are not yet ready for surgical interventions such as a face or a neck lift. So the advantages of Ultherapy is that it is non-surgical, non-invasive alternative, and you can use ultrasound imaging to actually accurately target the layer that causes the skin to contract, and there's very natural and gradual results. But there are some important considerations that, aggressive ultrasound treatments may occasionally complicate future facelifts. And as surgeons, we always want to know our patients' full treatment histories. Make sure you talk to your provider with any kind of lasers and non-invasive procedures that you've done on that area in the past. Now we'll talk about the BBL SkinTyte. What is BBL SkinTyte? So it's actually part of the Cyton broadband light platform, and it uses infrared energy to gently heat the dermis, which is underneath the superficial skin, while keeping the epidermis safe through sapphire cooling technology. And how does it work? The controlled heat stimulates the collagen contraction and the fibroblast activity. And over time, this process leads to a firmer, smoother, and more youthful appearing skin. For the BBL SkinTyte, it's typically performed in a series of 3 to 5 sessions, and you'll space them out about 4 to 6 weeks apart. The actual laser itself is fairly fast, about 30 minutes for the face or neck, and it virtually is painless, and it kind of feels like a warm, tingly sensation, kind of like a nice warm massage. And there's really no downtime, and patients can return to normal activities immediately. And in regards to results and longevity, and patients will start to see improvements in the skin tone and texture within about 2 to 6 months, depending on how frequently you're doing it and how adherent you are to the schedule. And the maintenance treatments are recommended every 6 to 12 months, depending on the person. And you can use it for the face, the neck, the abdomen, arms, and even the thighs, which the Ultherapy is kind of localized to the head. The advantage of the BBL SkinTyte, it is quite comfortable and it's a repeatable treatment. You can actually use it with different skin types, and you can use it on various parts of the body, like I mentioned. So some considerations is that results are much more subtle than Ultherapy, and it's only really for mild laxity. It's not a replacement for surgery for individuals that are showing more significant sagging. Now I'm going to just do a quick comparison of Ultherapy versus the BBL SkinTyte. The technology for Ultherapy uses ultrasound, and SkinTyte uses infrared light with cooling. The depth at which it addresses, so Ultherapy reaches a deeper layer into the SMAS layer, and SkinTyte works on the dermal layer. In regards to the sessions, Ultherapy requires just 1 treatment, and a SkinTyte is a series of treatments about 4 to 6 weeks apart. And for comfort, Ultherapy can be uncomfortable for some people, and SkinTyte is generally painless. In comparing the results, Ultherapy will last 1 to 2 years, and SkinTyte results will last about 6 to 12 months with maintenance. Ultherapy is best for patients looking for a lifting effect, and SkinTyte is really ideal for like tonal and textural improvement across a broader range of body areas. In conclusion, the Ultherapy system and the BBL SkinTytes are the complementary tools in our aesthetic toolkit. And Ultherapy is ideal for deeper lifting with longer lasting results, while SkinTyte offers a gentle, repeatable tightening for bigger areas with minimal discomfort. So, and as always, patient selection and individualized treatment planning are really critical to achieving the best outcomes. So if you like these educational videos, give me a like and a follow.